Well, hi, everybody. Welcome back. You know the drill. If you have questions, drop it in the chat. If you rather unmute yourself and speak up, first raise your hand and we'll get to you. So I got two broad categories first to discuss today. So one is, so I just came back from this annual event of academic consortium for Integrative Medicine and Health have this annual symposium that was in Chicago. Dr. Frame, Lee, and I were there as co-planners of the event. So there's a lot of really interesting things. So I just want to give you some highlights of the event, and then we'll see where we end. And I also have a second topic, which is I have updates on the BOCA test, which is the new free direct-to-consumer cognitive assessment test that does not require you showing to the physician's office, and it's validated against the gold standard, which is called MOCA test or MOCA. And I'll show you the evidence for that. So some of the things, and again, of course, what I'm presenting about symposium is my take on this. And I'm sure there were tons of sessions that I missed that were amazing and wonderful, but I'll tell you the things that I've seen that really stood out for me. Well, first of all, I want to say that while Chicago may sound crazy in February, but we got locked out. We had a beautiful weather of like 45 to 60 degrees. We took some hikes and it didn't snow and it didn't rain, so it was good. I was really amazed with amount of advocacy that is done in the state of Illinois. I particularly was struck by Senator Fine. I'll tell you just a couple of words about her story. So she was a policy professor at the university there in Chicago, and her husband was in a horrendous accident, Mike Fine. Basically, he was hit by a drunk truck driver with no insurance, lost his arm, had 8 surgeries, 60 days in ICU. When he came out, he was in chronic pain. And the whole story started when they're starting to get over $500,000 in cash bills, with insurance tried to drop them, tried to basically say, sorry, we're not going to cover any of this, goodbye. They didn't realize, well, insurance didn't know that the wife, with her academic experience, she basically took insurance to court. But as a whole process of this predates Obamacare, so this is before 2010. But as a whole process here, she basically realized they ended up paying for everything, but she spent several years fighting, countless hundreds of hours. And after all of that, she started realizing, so they could do it, but what about somebody who is not like this? And she got really passionate, entered the politics, and now she's a senator out of Illinois. And she's done an amazing amount of things. What I find particularly striking is how much can be done and how much crap we hear, but we're not actually seeing what lower level politicians are accomplishing. And this is the first time after the presentation like this, I got really invigorated politically. You know, my kind of stance on politics is, we have this expression in Russian, there's only one way to enter politics, and then step into it as in a pile of S. And so that was my always attitude toward politics. But she really moved me and her husband, because the amount of things that she was able to accomplish. And what was most incredible with the story is her husband, Mike, he left the hospital on 35 medications in continuous chronic pain. It was because he lost the limb, the right arm. Basically, he's now with the phantom limb syndrome, which they tried to treat medically. Of course, it didn't work. So not until he started using all of the holistic approaches, multiple different things. He had some improvement with acupuncture, he had some improvement with Reiki. Not until he started doing yoga, and he actually became a Kundalini yoga teacher. And that's what actually got him off every single pill. He's no longer taking any medications. He's been teaching yoga now for 7 years, going around the world, kind of doing more of a trauma angle of the yoga. But imagine through all of this, Senator Fine, his wife, became such a strong advocate for the whole field. So basically what I took out of that is now I have to find my voice and figure out who's in Maryland can speak for us. And it's not a lost cause. We need to try to advocate. What's really cool, part of what she did, she basically created this bill, which passed in Illinois, that if you have a treatment, including medications, that is working for you, insurance must cover it, no questions asked. And that includes any modality. But there has to be lots of documentation, et cetera. But it's fascinatingly groundbreaking rule. Because if in essence, you found an approach that's working and you proved that it's working, you're basically hooking insurance for the rest of your life to pay for it, and they can't get out of it. It's only a handful of states, as I learned, pass something like this. Of course, it's mostly going to apply to medication, something like expensive seizure medications in pediatrics, but nonetheless, I think it's a very good, very, very good approach. So that's my highlight of that. We had a very good keynote discussing some of the Medicare updates and some of the kind of forward-looking directions. Unfortunately, that talk, while it was really good politically, and it really doesn't translate clinically to anything except for one unsettling thing for me, that forget about trying to do acupuncture and with Medicare. It's highly restricted. They are starting to chase around people who do Medicare and bill for more than $50 per visit. So most of the academic centers have dropped Medicare for acupuncture as of this year because of some of the things that have been occurring. There's a lot of audits. There's a lot of problems. It's only one condition that's covered. There's an attempt at trying to expand it, but there's a lot of resistance. So I've been very much looking forward to develop a model of trying to start accepting acupuncture for Medicare. I'm going to pause all of that and wait until better times, until I can see what my colleagues at places that see thousands of patients for acupuncture with Medicare, what they're going to tell me. The resistance is in the way the billing and documentation is orchestrated, and the fact that really Medicare is increasing amount of scrutiny, not decreasing. And at the moment, they're refusing to add any other conditions rather than low back pain. And for low back pain, you're restricted to only 20 sessions. And it's maximum. It could be even just 12 sessions in the first 3 months. It's not very clear where this is going to go. There are some states that have tried to augment these bills with some local, but most of the people I talked to, and the way that post keynote, we had kind of smaller internal discussion, it's very unclear how to do this. So there's a couple of places that have figured out how to do it, but they are closing their programs because of some of this newer changes that really negatively, and they're basically transitioning to a discounted model, which is what I'm considering, where Medicare patients get like professional discount, but then they get billed out of pocket and they given the bill to submit to Medicare. Theoretically, Medicare can reimburse for that if the provider is within the network for Medicare, but for whatever reason decided not to accept it. It gets really complicated in essence. There's too much logistical issues to be in a full compliance. So unfortunately, that's basically where it is. No, obligatory insurance coverage does not exist in DMV area. Yeah, it's only, I believe, Hawaii, some sections in California, Illinois, and I think another state, which maybe in Massachusetts. I can't quite remember, but somebody can look that up if you guys really into this. So that's second update. And I think the third one is very interesting. It was a very amazing speaker. He's actually on the TED. He has a TED talk. Before the end of today, if I find the TED talk, I will put that in the chat. box. His name is Abu Patel. He's an author, speaker, educator, and he's an interfaith leader. So he speaks about how we are seeing dramatic change in religiosity in the US. Basically, the Christian, particularly evangelicals, are rapidly becoming minority. If the trends don't change, that we're going to have 2/3 of the country represented by Buddhists and Muslims within about 20 years. And the trend is so rapid that and it's not often discussed. I find that interesting. I've kind of heard of this information before, but I didn't realize the scope of it. So if things don't change, that basically the current political discourse is irrelevant, because the voices are drowning, basically going rapidly down, and nobody mentions this. And then I love how Dr. Patel tried to make this very positive, because you could make this very negative. I mean, our country is so divided. You can make it even more divided by knowing that this change is happening. But he made it very positive. He basically asked the community of physicians and healthcare providers to say, look, this is the only area where all of this interfaith comes together and just in a matter of service and healing. And that's the place where I think we could be the strongest voice of unity, and we don't have that. Like we're not doing enough of it. We're just doing the services without often paying any attention to who's who in our own clinics, in our own hospitals. But we could be such a powerfully positive example for the rest of the country. And he was talking how, in the same hospital, you can have a Jewish anesthesiologist with a Buddhist surgeon with a Muslim nurse treating a Christian on a table, doing the surgery. So it's very, I think half of the place was crying when he was talking, because it was so touching and so powerfully helpful for us to understand that, we could transcend some of these differences in politics in our country and say, we could do better. But the trend itself is not, if nothing changes, going to shake up this country quite a bit. The Muslims are the fastest growing group. The Buddhists are the second fastest, and then the Hindus, and then there's like several smaller groups. They're still really fast growing, but their total numbers are smaller. And then pretty much multiple Christian denominations are rapidly decreasing at the rate according to the increase of others, in essence. I'm not talking about the absolute numbers. I'm talking about the ratios, right? Because that's what's important, not the absolute numbers. So let's see what else. What else did I feel was really interesting? There was a lot of conversation about how much we are in need of a better overall delivery of whole health in the country, and how it's not necessarily an integrative medicine, but it's kind of all-inclusive term. So meaning that there's a lot of different fields now that are delivering, in essence, kind of a holistic whole health care. Lifestyle medicine is a whole separate direction. And of course, integrative medicine, then there's this concept of functional medicine, the naturopathy. There are all these fields. And one thing I think that we haven't done well enough, and that's what part of the conversations have been occurring this past week, is how do we all come to the table together and represent one voice? Because part of the problem why we're not such a good advocates for our own for our own patients is because we in our silos, and while industry actually figured out how to do it collectively, and that's the lobbying. Healthcare lobbying is the strongest lobbying in this country, actually. But our fields and our smaller silos haven't figured out how to do it, and I think that that's a shame. But hopefully, we will get better at that. So I also felt that that was a very important part of kind of general discussion. I'll put I don't think you guys be too interested in this, but I'll put the link to the Congress in case somebody wants to look at the agenda and you guys have some questions for me. So, any questions about anything I just said? I'll put the link. All right, it's taking me a minute to find. Let's see what questions are about this, and then we can talk about the cognitive stuff that I still want to cover in a couple of minutes. General, what proportion of Medicare populations covered by Medicare? I don't remember but pretty much you can think that most patients over 65 in this country are covered. I believe it's, I don't know, is it 20% of the entire population, something like that? Unfortunately. So, Jennifer, I agree that there's a lot of politicians that are for life, but it doesn't mean that there are no new politicians who are much more progressive and whose views are, who's gonna like what integrative medicine has to offer to healthcare. Let me give you one example of what I'm gonna try to do. So I'm meeting with the head of population health at GW within the next couple of weeks. And I'm gonna ask for pilot studies to do a couple of things. And one of them is to basically cover the long COVID expenses for patients. And another one, now that we have our Alzheimer's program is doing so well, and we have 75% response rate, either not progressing or resolving Alzheimer's, I'm going to ask Medicare to cover the cost of the program in a pilot for, I don't know, 10 patients or whatever. So I don't know. I mean, I think we could try to do pilots and things like this, and then popularize the results, and then really go out there and say, look, you're wasting all these resources. The drugs for Alzheimer's is something like the Adalimumab, I think, is a $65,000 a year just cost of drug, and then you have to get MRIs and visit physicians. You're probably looking at least $100,000 a year, and there's no chance of recovery with that. Here's the program that's going to cost 10% of that, and then you have 75% chance of not progressing or resolving or getting better. I can't speak to them, but I can show them the data, and I can show them the cost and say, hey, you make a decision, but ultimately, if this is going to grow and you out of this, politically speaking, if you're running these programs, it's going to hurt you if you don't support something like this. So there is ways to communicate about this. That's, I think, takes time and effort and a lot of different collaborations and finding other people who can support this. And so that's what I'm kind of made myself this week commit to start doing, which I really was not interested in the past. Okay, is the reductions of, well, it's not a reductions of Christian. No. I don't think there's a conversion. It's just simply the generally people who either enter religions or tend to enter more of Islam and Buddhism, or simply because those populations naturally grow faster. There are more children, and then they're just. Oh, and then the other interesting fact was that the average Christian in this country is around 60 years old, and average Muslim is 35. So, and the Buddhist is like in between, like late 50s. So, no, nothing for long COVID is covered by Medicare. Not a single integrative treatment that we apply. Medicare does not cover acupuncture for long COVID. It covers nothing for long COVID. I mean, if you're going to see a specialist, it will cover it, or if you're ordering MRI, but none of this is going to help you. So, unless you have some specific medical problem, but those less than 10% of patients actually have medical problems with long COVID. What they really need is lifestyle treatments. They need graded exercises. The only things that are covered are physical therapy, speech therapy, and occupational therapy by Medicare. And also some of the psychological, mental things, like some of the counseling can be covered, like cognitive behavioral therapy. But beyond that, if you start applying things, let's say the dietary change, if you want to try an anti-inflammatory diet and you need a coaching, that's not covered. So in order for that to be covered, you either have to have end-stage renal disease on dialysis, or end-stage diabetes, or just A diabetes. So if you don't have those diseases and you're still expected to live a long time, Medicare say that's not applicable medical treatment. You should not, we're not paying for it. Remember, Medicare was never designed to be preventive care or an optimization and tool to have somebody live longer. They're clear about it. Medicare is an acute care only to prevent death. It's never been designed as a healthcare system for the United States of America. It was designed at the times where we didn't know what chronic diseases were. We didn't treat them in the 60s, right? We didn't consider that the population is going to be aging and getting older. It was just, you're in a hospital, we'll pay for your services. That's it. So you really, in essence, we need to have a massive change in an infrastructure of a healthcare but there's no interest in that politically on every level. That's why we have to put our voice in the mix and hope that after prolonged push, something will change.
Crazy.
Yeah, I didn't see anything about Latin America. No. All right, I have 5 minutes. So you have two choices. You can start asking COVID questions, which we didn't, and I don't have any COVID topics for today. I'm sorry, I was just wrapped up in the conference. I just gave back last night, late, so I didn't have time. Or I can show a little bit about the cognitive testing, your choice. But we have about 5 minutes.
I vote for cognitive testing.
The what?
Cognitive testing.
Cognitive testing. All right, no COVID questions. Are gut issues common in long COVID? Very common. Probably third most common problem. All right, everybody want cognitive testing. Ooh, I like that. Cognitivir. Oh, that's a new one. All right, I suggest, Elizabeth, you try to sell that name to a drug company. Somebody will pay for that. I can guarantee you. It sounds really good. All right, so I'm gonna put a little slide. Just give me 1 second. And then for the full presentation on this, I'm gonna put a link to YouTube video, and you'll be able to see the whole thing. Okay, so. All right, I should be able to manage this in less than 5 minutes. So, not surprising. Can you guys see the screen? Everybody can see the screen? Okay. So, Alzheimer's is really an epidemic. It's the most expensive disease in the world. If nothing changes, it's going to be a second or third cause of death in the world within a couple of decades. The problem, there's multiple problems, but one of them, and probably the big one, is the fact that we really should be treating the Alzheimer's here. By the time it gets to this point in clinical disease stage, it's too late. The tools are very non-effective. But how do you get someone over here, and how do you actually influence this stage? That's where we're currently clinically need to develop more effective tools. And that has to start with an effective screening, right? If you can't identify a person at risk, then your approach is useless. So there's several large organizations that basically for a long time have been saying at least 30%, some people believe half of all the cases of dementia can be completely prevented by just effective implementation of lifestyle programs. But how do you do that? So, you have to develop the test, an assessment screen that is low cost, simple, ideally direct to consumer. So it removes that step of, I have to go to the doctor to get some tests done. You know how difficult that is. Plus, if you go into a doctor and your doctor has to spend half an hour doing this test, guess what? It's essentially unrealistic. The geriatrician is supposed to screen every person over 65 once a year. But practically, I will tell you, it's not happening because the MOCA test, which I'll show you in a second, takes at least 20 minutes to do. And that's this test. There are some other tests like this CNS Vital is an outstanding direct-to-consumer test, but you have to pay out of pocket for it. You cannot actually do it on your own. You can't just go online and buy it because it has to be sold through a healthcare practitioner. And if I see the raise of hands as your primary care doing this test, I can guarantee you no one have even heard of this, because that's very unusual. Only few neurology test centers in the country utilize this test. So this is why we developed this test. Well, I didn't develop this. I've been in the early phases of utilizing this test, but as I'll show you in an article in a second, I was on that paper. So it's a direct-to-consumer, don't cost you anything. All you need is a laptop or a computer or tablet to do this. It's very similar to the MOCA test, and it can be immediately incorporated into your healthcare records. And it's fully HIPAA compliant, fully clinically ready test. And it's currently, I think it's in 6 languages, and I'm sure they're going to add more. And the most important aspect, I recommend everyone in our RECODE program, Reversal of Cognitive Decline, to do it weekly, because the test, you cannot really learn how to take the test better. We actually tested that and in a control settings. So this is the study. You know, if I can, you're going to get the slides if you want to come back to this. This is the link, the bell curve and me, Boston Cognitive Assessment. That's where you can find it. This is the actual study that basically looked at comparing the BOCA to MOCA. This is published in BMC Neurology. It is an open access. And in the YouTube link that I'll put in the chat, you'll be able to get to the full study if you're interested in reading the study. Actually, I'm going to show you this slide. This is the actual study, and the correlation with MOCA test is very good. But what's even more important is that this in training doesn't exist. If you do this with MOCA test and you ask patients to do this test the way this was done, which is number of trials within just a couple of days. So let's say they will do 10 trials in 2 days, everybody's scores will go up because they will memorize the test they just did. This doesn't occur with this test because it's a random generated test, and it doesn't matter how you performed on the test before. So we have proven that even healthy volunteers with no cognitive impairment can do pretty well. 2 outliers, but you know, on average, nobody improved significantly. So the way it looks like, you have to get to this website, click on this BOCA, and then register into system and take it. Now, for patients who are our patients, we're gradually going to add everybody into the practice, and then you get a link. And when you do the test, your information is stored on our end, so we can always have access to your records inside our HIPAA protected portal. So we don't have to worry about loss of the results. You know how medical records are. If you didn't give it to your doctor and then something happened, you lost the test, blah, blah, blah. None of this is going to happen here. And with that, that's all I have. Wow, 2:31. I'm just 1 minute late. Again, I'll put the link to my YouTube video about it, and then maybe I have a time for 1 or 2 questions, and then we'll pass everything to Aliza. Is low back pain covered by Medicare? Yes, so theoretically it's covered. The problem, Caroline, it's very hard to find practitioners for this, and it's only covered for 20 sessions. But in essence, you should try to look for someone. If they accept Medicare and they have a good reviews, go for it. Because if they figured out how to do it, that's good. Now, what the future holds, it's hard to say. Unfortunately, I was hoping that the future will start improving. 2 years ago, when we first heard about it, there was a lot of excitement. And now that excitement is seemingly, you know, going away, unfortunately. Will BOCA be? Yes, the BOCA is already available for all RECODE patients. You have to be our RECODE patients, but yes, it's already, all RECODE patients already getting it for past 6 months or so.
But what you're talking about doing, Dr. Kogan, I thought was expanding it to all, possibly all GWCIM patients to access it through your portal and have the results stored. Is that what you're talking about?
That is correct. Mm-hmm.
Any timeline for that?
It's already in place.
Oh, so you don't have to be a RECODE patient to do it?
No, you just, if you're not in our program where we can monitor you closely, if you're not in the settings where you have a practitioner who spends time with you, you can do it on your own. You don't need us. But if you're already in the RECODE, you know, RECODE is a packaged program, then we assist patients in how to run it.
Okay, I understand. Thank you.
Yeah, you can just sign up for it directly. All right, one more question and then we'll move on. All right, well, very good. With that, Aliza, thanks so much for joining us. Tell us a little bit about your practice before you tell us what you're gonna, the mindfulness practice you're gonna do for us.
Absolutely. So my name is Aliza Scharf and Dove. I do practice from a really integrative place.
Is there anything you can do about your sound? It's kind of funny.
It's buffering.
Like you sound like a frog.
No,
we don't want that.
Oh,
that's
I'm not sure. Is it better?
Yeah.
Okay. If that happens again, let me know. I can try headphones with the microphone.
Also, if you have any other windows up, you might want to close everything and only have this up.
I don't think I do. Nope, it's just this one. Am I okay?
I think it's worse for some reason.
Let me try a microphone.
So I put the YouTube link while we're waiting for Lisa. So the links to the study and to the book itself is in the YouTube channel. So that may be the easiest way to get to everything in one shot.
Okay. Is this better for folks when I have the microphone?
Oh, it's much better.
Okay, great. It's a new computer, so there might be something going on. Anyway, thank you for having me. I do want to give you background and context and actually make really explicit that giving context, I'll give context for the mind-body practice as well, creates safety. So anybody who deals directly with patients, clients, giving really explicit context for who you are, what your thinking is, where you're coming from, creates safety for the client. And it also helps mitigate some of the power differential and create a more healing environment. So yes, I do practice from an integrative perspective, body, mind, spirit, biopsychosocial, spiritual approach. Just a snippet. I actually am fortunate enough to have been trained in the right ways from the beginning. I really began as a therapist in the tradition of family therapy, which looks at the whole system and has a foundation in ecological theory, which really takes people in context of their environment. So just a little bit of that location of self. I find that my deepest seat is in my non-dual healing training. That was a very rigorous 4-year program where we really went into our own histories, our own bodies, and it's just a wealth of awareness, really, awareness in relationship. And I will finally just say it is my passion and calling to restore relationships. That includes relationship with self, those closest to us, ancestors sometimes. So it is my privilege to be here. The practice that I'm going to bring in today is from training I've had in somatic attachment therapy in particular. For those of you who might be familiar, somatic attachment therapy is largely based in somatic experiencing, Dr. Peter Levine's work, and interrelationship focusing. So those practices are from that modality. We're going to be practicing resourcing, orienting, and focusing. resourcing and orienting are really all about coming back to the place and places that are already okay within us. I believe very much that we are designed to heal, and what allows all wounds, physical, emotional, to heal is actually the foundation of strength that we already have. That can be in our own bodies, it can be environmental. So this is a practice that really honors and locates some of that strength that already exists, the resiliency, if you will. And on that foundation, that final part, focusing, will include some space for parts of us that might feel less okay. But that's only after we've really grounded ourselves in the resources and strengths that we already have within and can locate in our environments as well. Okay, any questions before I guide folks into the actual practice? Okay. So I'm going to start by inviting folks to find sort of a comfortable place in their chair. If during this practice you need to shift or move around at any point, please feel free to do so. So if you're in a chair, you may want to, lean back into the backing of the chair, support your lower back in particular. If your legs are crossed, you might want to uncross them. Plant your feet on the floor. If anybody feels the need to lie down, that's fine as well. There's a lot of freedom in this practice. Feel into what feels right for you. So once you find a comfortable spot, and again, you may need to shift around a little bit, feel free to do so. Start to focus on your breath. I'm just noticing breath. While you're noticing breath, you're invited to close your eyes if that feels right for you, or you can keep them open, maybe softening them a bit. Softening your gaze. Again, closing your eyes. We are going to begin our journey by focusing inward. So including breath, eyes closed or softened, comfortable place. Starting with the tops of our heads, we'll work our way down. Take note of what already feels good or okay. Perhaps your eyes feel relaxed. Perhaps cheeks are soft. You may even notice the temperature in the room feels okay for you. The body feels warm. If you notice parts of yourself that feel less okay, you can notice them, but we're going to bring focus back to the parts that already feel okay. So working your way down, jaw area, throat, neck, what parts might already be relaxed, soft, Feel good even. As you make your way down the shoulders, and chest, particularly noticing your chest as you breathe, as you inhale and exhale. What feels good? Making your way down, solar plexus, abdomen, notice any parts that feel relaxed, soft. Notice as you breathe what begins to relax and soften. Take note of your back, if it's supported behind you. How does that feel? That support behind you. Know if you need to, you can lean back into it. Your support meeting your back. And notice that seat under you. Feeling where your legs touch the chair. Noticing how that feels. Making your way down to your knees. Your calves, your shins. Again, if you would like to move around at any point, please feel free to do that. Moving into what feels good and right for you. And finally, down the ankles. Through your feet, heels, toes. If your feet are on the floor, notice what that feels like. Where your feet touch the floor, supported by the floor. When you're ready, you're located within your body, what feels okay or good. You can slowly, if your eyes are closed, open your eyes, or if your gaze is softened, you can start to focus in your environment. And I'd like to invite everyone to really take a look around the room. Start to explore your surroundings. That can include in the room, a window, the picture outside. And take note of what feels good. What might be relaxing, comforting? It could be a paint color, be flowers or a painting. Could be the view out your window. I'm watching the rain and bare trees outside of my window. Really notice textures that speak to you, colors, objects. What helps locate you within the room? And if at any point you need to come back to resourcing inside of yourself, you're invited to do that. Because that is our nature. We go inside and outside, back and forth. It's not one or the other, it's both and. You might want to play with that for a moment. What's it like to focus inward and outward, back and forth? Really exploring what feels good for you in this moment. What feels good for us changes from moment to moment, from day to day. And finally, you can gaze at any object, place, color, location in the room, and just allow yourself to land there for a moment. I'm going to invite everyone to take a nice deep breath. Nice long inhale and exhale. And if you choose and it feels right for you, you may want to come back to one of those parts you might have noticed that felt less okay. And we're just being open and curious. This part is willing to be held, explored a bit. You're invited to come back to that part in your body. It could be an ache or a pain. It could be a place that felt funny or off. You can do this with eyes open or closed. Many folks find this easier or more accessible when their eyes are closed, but whatever feels right for you. Staying with that part that might feel less okay or may need a little attention. Just noticing it. Does it have shape or texture, movement? Staying with this part, noticing shape, texture, colors, perhaps, movement, perhaps. You can even play with it. You can imagine it coming outside of your body so you can look at it in front of you and go back and forth. Just exploring it without judgment, with curiosity. The curious lens is the widest lens. And finally, if it feels right for you, you're invited to ask that part if it would like anything from you or needs anything from you. Knowing it's okay if it does or does not want to or choose to share today. It's about being curious, creating dialogue with ourselves. And when you're ready, you can thank that part for showing up today. And all of your other parts for being present as well. Okay. Now folks can slowly start to, recommend wiggling a little bit, just kind of coming into our bodies, moving around a bit. Yeah, shoulders are a good one. I know that's one I always come back to. Yeah, stretching a bit, moving around. Okay, and I'm self-disclosure, I'm used to doing this in a very interactive kind of way. We don't have time to really go through people's experiences, nor is that required at all, but we have a couple of minutes, and if anybody wanted to share anything or ask questions, I'd like to leave space for that and invite people to do that if they choose.
Thank you so much. This was wonderful. And yes, we have a couple of minutes for questions. So if anybody have questions, comments, maybe people want to say a word, how you feel.
Mm-hmm. One thing.
Discomfort does have a shape. I love that. That's such a good statement.
Oh, so non-dual therapy is? That's hilarious. Can I say a bit? I'll try. I could say a lot. But I learned a modality, it's called non-dual Kabbalistic healing. And the basic premise, and you're going to ask different practitioners and they're going to say it in their own way. We really work with holding opposites in relationship. So you have, black and white, and then you have a much bigger thing, which has to do with the relationship and the distinction. So that's kind of the non-dual part. So it's distinction and relationship. We learned really it was two traditions in my training. This is the work of Jason Schulman, and it's based on Buddhist teachings and Kabbalistic teachings. And he received direct transmission from both Kabbalist and Buddhist teachers. So I love it because as a healer and a therapist, it's really about us actually all in this same human boat healing together. And that's another liberating point. I'm not just here in service of another person as if I'm an absent being. We're all here healing together. And we do work very, very deeply with opposites. if that helps. I said, it's hard to say a bit. Okay. I'm just going to throw a question out to folks. Don't have to answer it, but this comes up when we do notice this stuff. Gotten some really interesting feedback on how some of those parts that feel less okay actually start to move when we focus on them. Okay, I have another question popping up here. So folks can think about that. Can your work be as effective on Zoom as it is in person? I have found that that has a large amount to do with the practitioner's comfort doing it on Zoom. So I've done it for a long time, actually pre-pandemic, because worked with folks from different locations. And yes, I strongly feel for this kind of work, you want to be with a really good practitioner. And if that means meeting virtually, then go for it. Is there another question? Did I miss that?
No, Janet just posted what
Okay.
we do next week. So we always tell people for the next week, we have Niall, who's been with us many times. And unfortunately, it sounds like Sage has been in a bike accident. So we make sure we send him some good energy. Hopefully he'll join us next time. And I will promise I'll get a haircut by next week. Because it gets out of hand. I can't do it.
Yeah, you're getting a little mad professor there.
A little, as long as it's a little, I'll take it.
Okay. Well, Aliza, thank you. It was a pleasure.
Thank you so much.
Thank you.
I think if there's an interest, maybe if you want, we can have you come back and do a wellness talk instead of the mind body. So talk a little bit about, sounds like people are interested in learning more, some of this particularities of what you do. Young Einstein. I'm not Einstein and I'm not young, but I appreciate the sentiment though. So everybody have a good weekend. It's nasty outside, but I hope it gets a little better. And if you're avid skier like us, Liberty is open, but Whitetail is closed. Bye, everybody.
Bye. Have a good weekend.
Bye.
Thank you. Bye.
Thanks.